Hi all, welcome to our podcast in conjunction with London Care and Support, LCAS. We know how busy you all are at the moment in the care sector, huge amounts of pressure. So we hope that this short video will give you some key insights when it comes to health and safety in the COVID-19 world. My name is Mick Feather and I'm the Care Business Manager for Citation. And I work alongside our care association partners to support members with health and safety, employment law, and many other services to support you as care providers. I've worked at Citation now for over 3 years, and prior to that I was a CQC inspector for 5 years, but don't hold that against me. So we've partnered up with LCAS for many years, and we're delighted today to be joined by Peter Webb. So Peter, would you like to introduce yourself?
Hello, thanks Mick. My name is Peter Webb. As many of you will know, I've run LCAS for a number of years. I've got about 20 years background working for social care businesses, and we've partnered with Citation to very usefully do a lot of outsourcing of areas such as health and safety, human resource, and other areas, which are very useful for managers and owners because they just can't be experts at everything.
Excellent, thank you very much, Peter. So James, would you like to introduce yourself?
Yep, thanks Mick. I'm James Norman. I'm one of the health and safety consultants at Citation. So I look after a range of clients in different sectors, including the care sector across all spectrums of care, from domiciliary care, residential, supported living, and basically, my role is to help clients comply with their health and safety duties under the Health and Safety at Work Act. That involves inspecting their businesses regularly and helping them with risk assessments and training and helping create their health and safety policies. I've worked in health and safety for about over 10 years now in different sectors, but this role that I do at the moment is very great for me because it gives me a lot more exposure to different sectors and learning lots as well. Understanding how businesses need the challenges that they have to comply with their health and safety.
Great, brilliant. Thank you very much, James. So let's go to some questions. So first up then, we're going to be looking at COVID risk assessments. So over to the question, Peter.
Okay, thanks Mick. It's a particularly difficult time for SME social care providers with the pressure of the pandemic, affecting the day-to-day working of business. I mean, what measures do the providers really need to consider in respect to their infection control arrangements, as an example, and how can we make sure that all staff are aware of what they need to do?
Well, one of the things that every business, whatever sector they're in now, but including care, will need to ensure they've done is what's called a COVID secure risk assessment. And that's going to be the baseline to assess the activities that the organisation wants to continue doing. I think before you do any sort of form of risk assessment, it's important to ask yourself if you're competent to do it, and if you need and decide whether you need any external support, advice, or further guidance. So there's lots of obviously information from the government have issued out recently. The thing with risk assessments is they can often be seen as a bit of a tick box exercise, I think, and that's not their purpose. They're there to guide you as a business tool to help you with your organisation. So that's where all organisations need to start. And that should consider all the hazards in their working activities and how COVID-19 is going to impact that. In terms of infection control, specifically, I think it's important that we really now start looking at what you were doing before to control infection and see whether this is sufficient now in light of COVID-19. We know that COVID is very infectious and it can easily spread if we don't put suitable measures in place to protect both service users and staff and visitors as well. So one of the things we're going to need to look at is how we're going to enhance our cleaning measures, and that really does need to be stepped up. I think on cleaning, it's really important that you look at your cost assessments and understand things like contact times of surfaces. Many cleaning products will require a sufficient contact time for them to be effective to kill off the viruses or bacteria or whatever it is you're trying to protect people from. So simply spraying and wiping, you may have done that in the past, but that's not going to be effective now. So reviewing what you're doing and how often you're doing it and the method that you're using to do it is very important. All care organisations are going to need to start thinking about cleaning of all hand contact surfaces. This needs to be much more regular and at much more regular intervals throughout the day. So anything you touch, door handles, light switches, stair rails, lifting equipment, anything that's regularly touched by your hands, the list is very fast. In a care setting, in all sectors of care, is going to need to be regularly cleaned. I think as well, with respect to infection control, it's really important that you encourage an excellent respiratory and hand hygiene. This needs to be done in terms of making your staff aware through regular training. So there's lots of online training courses that you can provide, but you can also do team briefings and just really advising them how to do it. But it's not just enough to train your staff. You need to monitor what they're doing, and you need to advise them if they're not complying with the correct methods that you've trained them on. So I think it's very important that you consider that as a training aspect. But I also think to help with the process, you need to give your staff and your visitors and your service users the tools to make it easy for them. So one of the things I've advised some of my clients recently is to set up what we call hygiene stations. So that would be maybe potentially sanitizer, tissues, a bin that they can dispose of the tissues in, and not just have them in one place, but have them set up at strategic points in the premises. So think about the layout of your premises. So potentially hot spots, if you like. And ask your staff as well, watch what they do and how often they're touching things and where these sort of stations need to be set up. Staff training equally in terms of infection control needs to also consider how you're going to identify symptoms, both in themselves and service users. And I think it's really important that as a manager of any business in any organization, that you empower your staff that if they do present symptoms, that you'll support them in following all the self-isolation guidance as soon as they become aware, because they may feel a bit concerned about, advising you that they've got symptoms, about the potential ramifications that may have on their role in the company. So you need to be really clear that you fully expect them to follow any guidance that's been issued out from the authorities in that respect. I think as well, in terms of care and service users, you need to start thinking about potentially narrowing down the number of staff that a service user is exposed to, because in the past, one service user may have seen many different members of your team for different types of care and services. If it's possible and it's safe to do so, it may be a good time to review that and narrow it down to help reduce any transmission risks. And I think, to be honest with you, from what I've seen, even just on the news, really, I think a lot of providers are making great adjustments. They're thinking innovatively. I've seen things like care providers asking their staff to sort of pitch up tents in the gardens and things like that, just so they don't have to go home and leave the environment, and therefore not potentially bringing in the virus to the home. And that's not going to be relevant for every organisation. Not every organisation is going to be able to have that. But I think looking at what other providers are doing and sharing best practice is really a really good thing to do in terms of helping with infection control. I think it's really important as well, we don't forget domiciliary care, because it's quite easy to talk about just residential type care homes, but with domiciliary care and supported living services, it's about training your staff to be competent enough to be able to complete a dynamic risk assessment of their service users, to be able to identify any potential concerns that they may have with the service user or themselves. And equally, in terms of PPE training, making sure that you don't just provide PPE, but you train them how to use it safely and the instructions. So if it's disposable PPE and it's single use, it shouldn't be worn between different service users. So that's another way we can prevent the transmission risk. But all of this and many more things need to be identified in a detailed COVID secure risk assessment. And that needs the full cooperation of the staff involved to ensure it's effectively delivered. And really communicating with them regularly will get the buy-in that you need. As I said at the very beginning, risk assessments aren't meant to just be a paper exercise. They're a tool to help you, and they should be regularly reviewed, and it should be a live document. So the more you engage your staff in that process and get their feedback and the training on them, will help you deliver what you really want them to do.
Okay, do you want to add anything more to that, Pete, or you've got another question?
Just a quick point before moving on to the next question. I think it's very important. Training is extremely important, and it's the sort of thing that needs to be repeated and documented, particularly two things that give staff confidence, and also it's useful for CQC when they're starting to review inspections, and also for local authority quality monitoring teams. Moving on to the next point. James, are there any specific issues providers really need to consider with respect to vulnerable staff, or at those risks proven to be more at risk, such as the BAME sector?
Yeah, definitely. I think when we first heard about COVID-19, when it first hit the headlines, we in this country particularly were made pretty quickly aware of the high-risk groups in our population, the ones that are asked to shield, for example, and even the moderate risks. But more recently, as time's progressed and we've learned more about the virus, we've learned more about the BAME groups and the potential added risks that they have in terms of contracting COVID-19 and the implications that that would have for them. So as we learn more, it's important that employers update their assessments and regularly review them with the new information that we have. As an employer, you've got to protect all your staff. Now we've got this new information, you need to approach it in the same way you would by documenting risk assessments. And prior to COVID, most organizations would do individual pregnancy or new and expectant mother risk assessments or young worker risk assessments. And I think the same approach needs to be followed with respect to vulnerable people, including those in the BAME group, because that way then you know what that work is going to potentially cause issues for them. But as an employer, you need to find out which staff fit those groups, whether it's BAME, whether it's someone who's pregnant or someone with an underlying health condition. So some of these will be obvious to you, but others you will need to consult with your staff to find out more about their particular individual needs so that you can focus your attention on them. I guess I'd suggest just being open and honest as well about the reasons why you need to know this information. I think I would also suggest thinking more widely in that you may need to know if they live with anyone as well that potentially fits those groups, because they may have a concern about how their work is going to cause problems for their loved ones or their close family. So it's about having more open dialogue and communication with them. In terms of keeping them safe, you might need to adapt their job role. Just because someone fits a certain group doesn't mean that they shouldn't work. As an employer, you need to think about other ways of making them safe, but keeping them in the workplace if possible. That's going to depend very much on, in care, for example, if they're frontline or if potentially if they're more of an administration role where they work in an office. So the different approaches will need to be tailored to that individual. But you may need to adapt their job roles or their working patterns to keep them safe, maybe looking at redeploying them into a different role, for example. But I would also suggest asking them how they feel about any changes that you're likely to make to their job role, because they may have suggestions that you can work together with. And like I said before, with a risk assessment, the more you engage and you consult, the more buy-in you'll get, and therefore hopefully keeping more people safe. It could be they don't want to change their job role, but I think the duty of an employer is to really explain the risks involved and why you're doing what you're doing. The main reason you're doing it is to keep them safe, and that's your number one priority. Although you would do individual assessments for these groups, I think it's important as well, just going back to the COVID assessment, the general one, that you cover it off in there as well, because ultimately that will help everyone in the organisation understand what you're doing and why you're doing it, whether they're in those groups or not. And that allows them to help you with your whole effort on a holistic approach.
Thank you very much, James. I think it's a really good question, Pete. I think in terms of data, I think that's been the issue regarding this whole area in terms of sort of NHS and anyone else in terms of actually getting equality data, because it's one of those things that's not on everyone's agenda. Sometimes it's not necessarily obvious as to why it might be relevant, but I think something like this has actually brought it right to the fore as why it is relevant and why it is needed, because when you haven't got that data, then you can't actually identify the very people that are at most vulnerable. But just to sort of tie it quickly back into the sort of CQC, there is an angle just to let you know that it says in the emergency support framework that it's actually, when we're talking, or when the CQC are actually going to be talking over the phone to care services, it says, how are you proactively supporting staff who may be at increased risk of getting COVID-19, including Black, Asian, minority ethnic colleagues? So it's kind of watch this space, and hopefully equality monitoring data might actually improve kind of like as we go forward to make sure we can identify those groups. But thank you very much for that question, Pete, and thank you very much, James, for that answer.
Yeah, I think there's one actual point that James raised. It does show the importance of effective employment contracts and terms and conditions, because we've had quite a lot of instances where the employer has said X and the employee has said I'm not covered for that. And that's really where people need to have the right documentation.
Yeah, exactly right.